Morning, everyone. Thank you very much for the invitation to come to your beautiful country and your beautiful town. As you may have been explained, I'm a specialist in the UK. I treat breast cancer, bowel cancer, and prostate cancer. But I have an academic interest in designing clinical studies to find out about lifestyle and nutrition and how these could help empower patients to know how to help yourselves. So fortunately, it's very rewarding as an oncologist. The chance of being cured from cancer is improving all the time. When I first became a consultant, the chance of surviving breast cancer, for example, was 50%. And now it's gone up to 84%. So there's still a lot which needs to be done, but things are improving. So that means there's a lot of patients who are left with a lot of side effects from treatment. Now, a lot of you may be patients, so I don't need to tell you how you feel, but when you have extra chemotherapy, extra hormone therapy, you mean you have extra symptoms. Now, patients are often left with weight gain. They might have arthritis, bone density problems, nausea, fatigue. Now, in the UK, I don't know what it's like in Lithuania, the problem is the patients leave the oncology clinic and they go to their family doctor, but the family doctor doesn't know how to manage these toxicities. So there's a gap between the end of the main treatments and the patient enjoying their life, going back to a normal life. So what happens is they then talk to each other over the garden fence, they go on the internet and they get inappropriate advice and they start doing things which are unproven. And we want to try and stop this pathway of information and get official pathways of information. And I learned today that in Kauno they were starting a lifestyle degree in the university to address this problem. In the UK, we have this initiative called the National Cancer Survivorship Initiative, and it was set out to get the evidence for what patients should do and what they shouldn't do. And I was the lead doctor on the evidence review. So what we do in our clinic, we are attached to Cambridge University, and there are small hospitals like Bedford and Coventry. And we look at the international evidence, we review the evidence, but we also design our own trials. What we do with this information, we publish the information in medical journals to help doctors, to empower doctors to explain to their patients what to do. But we also publish in non-medical journals like cycling journals, because cyclists are very worried about prostate cancer. So, we advise the main cancer charities, like you're very lucky to have POLA over here. So we would advise how they write their information sheets to make it clearer. We also put information about lifestyle on websites, so patients who are interested can look themselves, and we have newsletters not only to say you should do this and you should do that, but we provide specific recipes for patients using foods like quinoa, buckwheat, lentils. And I'm not sure about you, but in the UK, most of my patients would have not heard of buckwheat or quinoa or use lentils. They use potatoes and meat usually. So we're giving them specific guidance, and we actually make movies, film clips of how to make these foods on a daily basis. And we have another website, keephealthy.com, and CancerNet as well. And we use social media a lot because you're more advanced than we are in terms of the internet, but we find it a very useful source that patients can look on, say, Twitter or a blog and get information on a daily basis to keep them motivated and updated. So I'd like to now go through which factors in lifestyle are most important. Now, number one is physical activity or exercise. Now, I won't bore you with the science too much. This was a paper we wrote and published 3 months ago. When you exercise, about 180 chemical changes occur in your body within 1 hour. And those chemical changes, most of them have anti-cancer properties. And just to summarize briefly, when you exercise, you reduce chronic inflammation, you improve your immunity. It acts as there's enzymes called antioxidant enzymes, which are enhanced. So your antioxidant enzymes improve. It reduces excess insulin, so you don't become insulin resistant or type 2 diabetes, and it changes the expression of your genes. So if you have some people who have genes which are susceptible to cancer, you switch off those genes, and you have other genes which fight cancer, and you switch on those genes. And for men, it slightly reduces the testosterone, and women estrogen. Does that mean it helps cancer? Well, yes, there's lots of studies now. There's over 1 million patients have been researched to look at the effects of exercise. There's been 30 large studies published throughout the world. So doctors who say there's no evidence that exercise fights cancer have not read the literature. There's quite clear evidence now between 3 and 4, well, a minimum of 3 or 4 hours of exercise a week, which means something which gets you a little bit hot, a little bit breathless, so you're actually exerting yourself. If you do a minimum of 3 to 4 hours a week, there's a clear reduction in the risk of developing cancer. It can slow the rate of progression if you have cancer, and it reduces the relapse rate and stops other diseases which could be fatal, like heart disease, high cholesterol. So the message now in most of the charities in the UK is you've got to aim for 3 or 4 hours every week. And if you forget to do it 1 week, you have to do 6 hours the next week. And there's lots of programs to try and get exercise rehabilitation for cancer patients. And there's even a qualification for a gym instructor to go and be qualified in cancer rehabilitation. So this is the number one thing you can do to help yourselves. But it's not just about being cured, it's also about how you feel. Now, we've done several projects on exercise, and many patients are worried about exercise because they say, well, it'll make my joints worse, it'll make me tired. But actually, the evidence, this is an analysis of 33 very large studies where people have been put into a program of exercise compared to standard care. And it shows that without any doubt there's a statistical improvement in joint pains, hot flushes, obesity, constipation, peripheral neuropathy, some chemotherapies cause pins and needles, depression, osteoporosis. This was a study we did at Cambridge which showed if you have radiotherapy to your prostate and you exercise during treatment, you have low risks of rectal problems and you're much more likely to maintain erectile function. Now, very rarely are people, when they go for radiotherapy, asked to exercise at the same time, and this is what we're trying to change the philosophy from doctors. You say, here's your radiotherapy, you go off and have 7 weeks radiotherapy, and here's a prescription for the local gym, you go and get a training program at the same time, which seems bizarre, but it works. What are the other factors? Being overweight. We know if you're overweight, you have a 30% increased chance of getting cancer. But more importantly, if you're overweight after cancer, you have a 14% increased risk of your cancer coming back. And unfortunately, most patients on chemotherapy are told by the nurses, don't worry about losing weight, you'll lose it afterwards. That's exactly the wrong advice. Unless you're really thin and you have a very terminal cancer, most patients put on weight during chemotherapy. So they should see a nutritionist at the start of chemotherapy so that they don't put the weight on in the first place. And good news is if you lose the weight, your risk reduces. So it improves. So vitamin D. In the UK, we have a big problem with vitamin D deficiency. Most patients, 80% of patients, are vitamin D deficient in the winter. And there are lots of studies shows if you're vitamin D deficient, you have an increased risk of cancer. The cancer is more aggressive and it's more likely to relapse. So, and there are some studies which shows treatment works better if you're not vitamin D deficient. we still don't know whether giving vitamin D to a general population will reduce the risk of cancer. There was a study published, in fact, 3 days ago saying maybe it didn't, but that was a study from North America where nobody was vitamin D deficient in the study. So the answer is to get your levels measured and correct it if you're low. There's a lot of talk about inflammation at the moment. Inflammation is what protects us through evolution from infection or from trauma. So if we're running across the desert and we get bitten by a wildebeest or something, the inflammation goes into the area, heals the wounds, and we survive. But of course, over evolution, our inflammatory markers, our pathways, are now too high. We have too much exposure to toxins in our environment. So our inflammatory pathways constantly being accelerated. The analogy I use is, imagine driving a car with your foot on the accelerator all the time and you're braking at the same time. So the engine is revving over and over and again to try and not even go faster, but just create more activity. And inflammation, although it stops infection, if you carry on being stimulated at that level, the chemicals produced in inflammation actually drive cancer cells. That they're called cytokines, and they have receptors on cancer cells, and it causes them to grow faster and metastasize. Now, of course, through evolution, that wasn't necessary, but now in today's society, we need to slow down inflammation. What can slow down inflammation? What increases inflammation is smoking, obesity, processed sugar, not exercising, and diet. What reduces inflammation is exercise, healthy bacteria, probiotic bacteria, dietary chemicals, which I'll talk about in a minute. These are the plant healthy chemicals in food, and there's different types of diet, like the Mediterranean diet and the macrobiotic diet. And there's a thing called the dietary inflammatory index. So you can look at a meal and you can say, is this going to increase inflammation or is this going to decrease inflammation? Of course, every meal should try to decrease inflammation. This type of food will increase your inflammatory index. Anything over 1 plus increases your inflammatory index. So processed meat, sugar, cheap meat, too much fat, and things which reduce inflammation, well, the Mediterranean diet, tomatoes, basils, herbs, and spices, olive oil, and that gives you a minus, so that it reduces inflammation. This would be the most ideal diet. It's called the macrobiotic diet, and this is lots of beans, pulses, chickpeas, buckwheat, quinoa, lots of salad with every meal. So a macrobiotic diet would have a salad for breakfast. They'd have things like miso soup, which is full of bacteria. And these give the highest anti-inflammatory index. Bacteria are very important, especially after chemotherapy or antibiotics. They've been damaged. And foods which restore the balance of bacteria. I think you've got kefir in this country. Is that right? Yeah. Sauerkraut, certain types of yogurt. In Japan, a substance called natto, which is fermented soya beans. These are the things which are very healthy. So on the negative side, which of the things should we avoid? Now, these are called carcinogens. These are chemicals which damage our DNA and cause the genes which we already have to be mutated and cancers start. Now, there are lots and lots and lots of carcinogens, and I don't want to just talk about them all just in 1 hour, but just as a brief summary, obviously smoking, asbestos, car fumes, radiation, I don't think is a problem here, but in the UK there's buildings which secrete radiation, processed sugar, candles, not cleaning your teeth. I bet you didn't realize that. So, you should explain to children, if you don't clean your teeth, you might get bowel cancer in 20 years' time. Well, I don't think that will persuade them, but it's true. Certain viruses and bacteria and parasites, talcum powder for ovarian cancer, and too much sun, not sleeping properly, etc. And I'll come on to the rest. This is a little bit technical, so apologies. But why are we talking about carcinogens when you already have cancer? If you've had my cancer, does it matter? Yes, it does matter, because for a cancer to go from the damage to damage the DNA to form a cancer cell, the cell has to go through a number of pathways before that cancer becomes significant, in other words, to metastasize and be fatal. It has to grow faster, it has to grow blood vessels into itself, called angiogenesis, it has to invade different organs, and it has to metastasize. Now, these processes are all governed by how we choose to live our lives. So this is what we can control. We can't control this bit because it's already happened, but we can control these pathways. So what are the things can control these pathways? Well, I've already talked about smoking. We all know smoking's unhealthy, don't we? But most people think smoking is lung cancer or is head and neck cancer. This is a data about bowel cancer. It shows that people who smoked after bowel cancer had twice the chance, they doubled their risk of the cancer coming back and being fatal. So the emphasis is put into lung cancer and head and neck cancer, but there's just as much emphasis on bowel cancer, breast cancer, ovarian cancer, that if you carry on smoking, you double the chance of it coming back. Alcohol, well, it's a mixed picture. Clearly too much alcohol is harmful. For breast cancer, 1 or 2 glasses of wine afterwards doesn't seem to matter. In fact, it might even be beneficial. For bowel cancer, there's no benefit. So the take-home message is it's either harmful or it's about the same. So try not to have too much. If you are going to have it, have a good quality and smaller volume. Now, sugar is the carcinogen which is becoming more and more recognized as very bad, not only for cancer, but for high cholesterol, heart disease, strokes, obesity. And I gave your Minister of Health last night, who I was fortunate to have dinner with, and I gave him an article we wrote recently, which is published this week actually, summarizing what happens to the body when you have processed sugar, and it is quite frightening. It's linked to increasing weight and fatigue. So people say, I need sugar because I'm tired. It'll just give you a short-term boost, and then you'll get tired an hour later. If you didn't have sugar in the first place, you wouldn't have that fluctuation. It causes diabetes, which is a risk factor for cancer. And these are the things it does. It reduces insulin. If you reduce your sugar, you have lower insulin resistance, and these markers of inflammation I've just talked about are reduced. And there are plenty of studies around the world which show that if you have sugar after cancer, you have a higher relapse rate. In fact, many research institutions are going a step further and are actually using diabetic drugs to treat cancer. So there's 6 ongoing studies looking at metformin, which is a treatment for diabetes, because they're trying to reduce the sugar levels in the bloodstream. I wouldn't recommend taking metformin yet, but unless you have type 2 diabetes, and I would recommend it then. So what we do on our blog, which is you go onto CancerNet UK and you click on the B, we give patients practical advice on how to avoid sugar in their diet, and things like recommending whole fruit. I've said sugar, but I'm referring to processed sugar. I'm not referring to fruit. Fruit is very, very healthy. It's got complex sugars. It doesn't increase the blood sugar very much, and it's full of healthy polyphenols and vitamins and minerals. So you can have as much fruit as you want, as long as it's whole fruit, but maybe putting it in a smoothie with orange juice or banana and mango, it can be too sweet. So if you make juices, make sure you mix them with vegetables. We actually have films, which I won't press because a film will come on, showing, for example, particularly first thing in the morning, if you have an empty stomach and you have sugar first thing in the morning, it hits your bloodstream and you've started the day on a inflammatory, promoting your inflammatory index. So that you get out of bed, you have cornflakes, or you sprinkle sugar on, or you have cereals which contain sugar, and the first thing it's done is told your body it needs to increase the inflammation. So we advise much more slow-release carbohydrates, of slow-release fats, so nuts, walnuts. Make sure you have to buy special cereals with no sugar in, which is difficult to find, and avoid anything at all with sugar. So even, I'm afraid, I know honey is one of your national dishes, but even honey first thing in the morning I wouldn't advise. If you have honey, have it later in the day, after a meal or something. So what are the other carcinogens? These are things called acrylamides, acrylamides, and these come when you heat carbohydrates. So if you heat potato, or you heat bread, or you burn bread, the black on the toast is carcinogenic. If you're interested in this, there's a website called the FDA website, Food and Drug Administration website, and it gives you the league table of which foods are most unhealthy. And in America, they're thinking of putting the acrylamide content on food now, and it would be quite frightening. So, for example, potato crisps are 300 parts per minute. Deep-fried thin chips are 400. The bigger chips are better. Anyone know what that's called? Pringles, good. What do you think the parts per million? If I said those were 300, what do you think Pringles are? Any guesses? 1,200? Close, 3,500. So they are off the scale. So if you Google cancer in a can, if you've got a mobile phone, put cancer in a can, Pringles comes up. So next time you're in a party and you're hungry, go for the celery and the cucumber rather than the Pringles, okay? So what's the other main carcinogen group? Heterocyclic amines. Now these are produced when you heat meat to a high temperature, especially if you cook it quickly. So barbecued chickens, well, this is bad because it's cheap meat and it's fried, and the black is highly carcinogenic. And the WHO recently issued a warning about meats, which was incorrect, because if you have a good bit of good quality meat cooked correctly, it's not particularly carcinogenic. What's carcinogenic is cheap meat and the way you cook it. But the WHO weren't able to give that message because it's too complicated, so I hope I can get that message over. And there's ways to reduce the amount of carcinogens on meat. You could cook it in an oven, so you could get chicken and cook it slowly in an oven for 20 minutes or so, and put it on a grill and avoid a direct flame, and cut off all the black, and that significantly reduces the carcinogen content. The other thing you can do is marinate the meat in herbs and spices to make it more tasty. So there's plenty of studies. There's a nice study from Maryland in Texas which shows if you use rosemary and you marinate chicken, and measure the amount of carcinogens in the bloodstream, it's significantly reduced if you eat it with salads, you eat it with tomatoes and herbs and spices, because these are the direct antidotes to carcinogens. So on a daily basis, when you eat, so if you go to a party or something and you tuck into the Pringles, you have a burnt sausage and you have a can of soda, you are completely doing your best to get cancer. If you go to the same party and they've cooked the chicken well, you have lots of herbs and spices, you have some water or maybe just one glass of red wine, you are on that end of the scale. So we need on a daily basis to be more on that end of the scale. And cancer doesn't take a day off, so it has to be every day, I'm afraid. So what are the antidotes in our diet, in our nutrition? I've already mentioned some herbs and spices, but the main antidotes in nature are called the polyphenols. Now, these are, you could say they're the gifts from nature. They make food taste nice, they make food look nice, and they make food smell nice. And they have enormous health benefits, from reducing your cholesterol, to stopping you getting type 2 diabetes, to helping joint pains, to trying to prevent cancer. So some religious people would say they're the gifts from God, and we need to find out how to explore them properly. There is lots of data to say societies who eat a lot of these foods, like the Chinese and Japanese and South Korean life expectancy is 94 years. They eat a lot of soya products, they eat a lot of vegetables, they have a low quantity of meat, which they tend not to fry, they tend to grill it, they have lots of teas, and there's many studies to show that it's the polyphenols is why they're living longer. If you're interested, we've done a literature review on polyphenols, which we published, and if you click on that website, you can download the paper if you're interested. Why do polyphenols have anti-cancer properties? Well, I've mentioned most of these already, but they have antioxidants activity, so if you eat a Pringle, it helps protect your DNA. They have estrogen activities, but healthy plant estrogen activities. So this is very important. The previous slide shows that if you have lots of foods with phytoestrogen, plant estrogens, you have a lower risk of breast cancer and a lower risk of breast cancer relapse. If you have exposure to xenoestrogens, which are chemicals in alcohol, in car fumes, that increases your body's estrogen. And the other things which increase your body's estrogen is being overweight and not exercising. So it is perfectly safe to have soya products, beans, soya beans, natto, things like that after breast cancer. They reduce chronic inflammation, they affect the expression of our DNA, and they have direct anti-cancer properties. So how do we increase on a daily basis our polyphenols? You can eat a lot of vegetables, and we encourage that, and we give ideas, etc. You can make some soup, which you have a lot of broccoli, for example. This is a big trend you see in railway stations, airports, where people mix up different vegetables, not fruit, maybe a little bit of fruit, but mainly vegetables. Or you can dry the food, if it's done properly, and put it in a capsule. And obviously, as a scientist who has to design studies, it's easier for us to use capsules because we can regulate the intake much better, but we're not suggesting a capsule would replace a normal diet. And the other thing with supplements you have to remember is most people are very confused about supplements. They think supplements relate to mineral and vitamin supplements, like vitamin A or selenium or zinc or vitamin C. But I'm talking about supplements where simply they've dried whole foods like mushrooms, or in this case turmeric, broccoli, pomegranate, etc. And they've just dried it and concentrated it. The reason why I'm differentiating the two is there are many studies, which I won't go into because it'll take too long, but there are many studies showing that minerals and vitamins taking over long periods of time do not help, and also there are some studies show they could be harmful. For example, there's a study from Scandinavia where men with heart disease were given vitamin B to try and prevent another heart attack. And what happened is, after a while, they realized the risk of cancer was a little bit higher, so they had to stop the study. There was the vitamin A and vitamin E studies, which showed that the people with lung cancer or head and neck cancer were given these vitamin supplements, and they had to stop the study because the incidence of second cancer was so high, so it was not preventing second cancers. The large SELECT study, which is looking at giving selenium and vitamin E to try and prevent prostate cancer, they again, when they did the analysis, they found that the vitamin E increased the rate of prostate cancer. So I've not got any study here showing any of these things actually reduce the risk of cancer, and some of them increase the risk. There was a very large study called the EPIC study, which is a European study, which had what we call a U-shaped distribution. And what they found was people who, for example, were folate deficient if they took folate, they had an improved chance of reducing their cancer risk. But if they already had a normal folate and they took folate supplements, they had an increased risk. So the answer is to be normal. You just want to be normal in the middle. Don't take too much and don't be deficient. So it does lead to a lot of confusion amongst patients because they don't know what they should be taking, and certainly there's confusion amongst doctors in the UK for sure. So one of the ways we've tried to create more evidence for this is the UK government and the NHS, the National Health Service, set up a committee called the Complementary Therapies and Lifestyle Clinical Trials Committee to try and design studies to get the answers. And I was lucky enough to be part of that. And what we did for the first 18 months is look at all the foods in the world, the superfoods, as you like, foods with high polyphenol content, and said which ones of these are most likely to have an anti-cancer property. So we looked at over 500 foods. We looked at Brussels sprouts, asparagus, chili, lycopene, tomatoes, lots of different types of mushrooms. And the ones which had the most evidence were green tea, curcumin, pomegranate, and broccoli. That's not to say others have benefits as well, but these had the most evidence. We also wanted to combine 4 different foods which had different ways of fighting cancer. So there's no point of having asparagus, broccoli, and Brussels sprouts because they're from the same family of foods and they have the same way to fight cancer. So, for example, green tea works by stopping cancer cells grow. Curcumin is very good at blocking inflammation. Pomegranate is good at it has an antioxidant effect, and broccoli affects the DNA. So the hypothesis was to try and develop a program which could work together and fight cancer, because taking too much of one thing probably wouldn't work. So we decided to do a randomized control trial, which means that you have to, in this case we had to make a supplement with these foods, had to be made to a very high quality and to avoid any concentration of pesticides and herbicides, which is the problem when you concentrate foods. This was a study now which we started in the UK, which was a non-commercial study. We had money from a charity to run it, and we started with men. Even though this was designed for all cancers, we had to find a group of patients who would be easier to evaluate. Now, in men with prostate cancer, there's a group of people who've maybe had radiotherapy 10 years before and their markers of cancer have returned, or they might have a slower growing cancer where it's not appropriate to give them treatment, but if they progress, they need treatment. And that's a very nice group to research because there's no other treatments being given, no radiotherapy, no hormones, no chemotherapy. So we're able to spot if an intervention, a dietary intervention works. And from that, we can maybe extrapolate to other cancers. And this is what we were pleased with. Even after 6 months, there was a very significant difference in the marker of their cancer, their PSA, a 64% difference between the placebo, a dummy pill, and the food which contained the broccoli, green tea, turmeric. We also measured MRI scans later, and there was a correlation between PSA and the cancer you could see. So that's very important. It wasn't just affecting the blood test, it was affecting the tumor as well. We were very lucky to present this in the world's largest cancer conference in Chicago, called ASCO, and it's a big privilege to get a poster, and we were given a oral presentation, which is 10 studies that year are given oral presentations from around the world. Now, considering we were competing against massive pharmaceutical companies, enormous high-profile institutions like the one you have here in Lithuania, we were very pleased to get this. But also, it's not just that we were pleased. The fact that these doctors now are recognizing that food could have a part in the normal management of a patient was a big step forward. And the trial has now been recognized around the world. This is the National Cancer Institute website in California, the biggest cancer institute in the world. On their first page on diet and cancer, they've got the Pomi-T trial, which is fantastic. In Memorial Sloan Kettering, this is a really nice website if you want to know any information about herbs or spices or complementary therapies. This is the site to go to, and they've featured this trial 4 times on their website. Now, of course, when we designed the study, it was a non-commercial study. It was an academic body, and we are a cancer unit. We can't make supplements, and our research manager is we only have a small research staff, so we were actually quite pleased that a company in the UK started making it commercially so that patients could get hold of it and not ring us or email us. And it's now actually made in Switzerland by a Swiss company, as they are allowed to do, because these are not drugs, anyone can make them, and they've decided to make them, and so if you want information, that's the website. So as a cancer unit, what can we do we've proven that these foods can help at least one cancer. What about other roles? Well, we have thousands of people now taking this around the world, and we get emails from around the world with other things. Like this is a patient who was about to have a knee operation, and they said, well, actually, they started taking this product and their arthritis got better, and they cancelled their operation. In the trial, we then looked at our patients and found there was a trend to people saying their arthritis was improved, which is interesting. So we had a cyclist who cycled around the world at the age of 17, and halfway across America on the way back, he had to stop because of a knee problem. He started taking it and he carried on. Maybe a placebo, we don't know. He's now talked to the Swiss people, and there's a whole team of people who take it. So this may be nothing, it may be true. We don't know unless we do the science. So we're working now with this organization called Arthritis Research UK, and they said, yes, it's a big problem, arthritis, and especially after cancer. And the foods you should be taking are not chondroitin, glucosamine, fish oils, which many people take, because there's no evidence that they help at all. The most evidence are these sort of foods, the polyphenol-rich foods. But of course, we can't do a trial in the general community because arthritis may take 10 years to develop, and we'd have to get 1,000 people taking these foods in one limb and 1,000 people in another limb. We'd have to compare if they get arthritis 10 years later. So we know from population studies they're likely to work, but it's hard to get the actual proof. But we have an opportunity in cancer. We know this was a trial we presented last year in Adelaide, in Sydney, where we asked our patient, what's the problem? What symptoms do you have? Tell us what your priority is. The biggest problem our patients had was hot flushes. And this was not just the incidence, because in medical trials you record the incidence of hot flushes, like 10%, 3%. We recorded what's the worst thing for you? So we say to a patient, what's really upsetting you? And what really upset them was hot flushes, 62%, arthritis, 55%. So this is what we need to be addressing. We need to focus on what the patient needs and then address what the patient wants, not what the drug company or whatever tells us they want. So we've now got this perfect opportunity to evaluate these foods to see if it reduces arthritis, because in cancer patients, arthritis usually develops within 4 months. Not 10 years in the general population, because we give them aromatase inhibitors, we make them postmenopausal, we give them Taxotere chemotherapy, all which induces arthritis. So now we've just started a trial where we're randomizing placebo versus this supplement, and we're going to specifically measure arthritis levels, but more importantly, we're getting every patient to be referred to a gym. So the poor patients have to take a supplement and they have to go along and get an exercise provision. And we're looking to see if helping their arthritis will allow them to exercise more. Because the other problem we had, you say to a patient, you need to exercise, and they say, I can't exercise because I've got arthritis. So if you help their arthritis, you might get them to exercise more. So we'll find out what happens next year when the trial finishes. The other problem is, another opportunity is that maybe polyphenols don't just work if you eat them. Maybe you can put them in creams or cosmetics or something. And this is a side effect of taxotere chemotherapy, where your nails can fall off and get very troublesome. Now, this is caused by chemotherapy damaging the proliferating cells in the nail bed. And there are treatments. You can freeze the nails like the coal cap, but they're not very popular amongst nurses. But we know that these polyphenols, they have anti-proliferating properties, they have antioxidizing properties. They also moisturize if you put them in a nice space, and they also have antibacterial and antifungal properties. So we've just finished a trial using a polyphenol cream applied to the nail beds during chemotherapy, and we're publishing this in ASCO in May this year. So you've heard it first today, actually, so don't tell anyone, because it's supposed to be embargoed until May. And we've literally eliminated this side effect with a simple, cheap cream which is freely available. So we're very excited about that, and that, we're happy that we've helped patients with this troublesome side effect. Are there other cancers we can look at? Well, the trial we did involve men not on hormones, but men with hormones are saying, well, what about me? Maybe if we take these foods, we can reduce when the hormones stop working. Because hormones eventually stop working, maybe we can prolong the period of control. This was a guy with metastatic prostate cancer who'd had radiotherapy twice, had hormones, had chemotherapy twice, and had nodes in his abdomen. And his wife, we were struggling what to do. We were going to put him in a trial, actually. And his wife said, no, I'm going to treat this myself. She made him lose a little bit of weight. She made broccoli soup every morning. So she concentrated broccoli, she put it in a flask. Every morning he went out the door, he had broccoli soup every day. You wouldn't think that would have a significant effect, would you? We couldn't put him in the trial because when he came back 6 weeks later, his PSA started dropping, which is a marker of his cancer. So we said, well, you just have to take the broccoli soup. No other treatment had changed, no hormones, and that's very important because many of these stories, they fail to tell you they also had chemotherapy, they also had hormones. No other treatment changed. His PSA dropped to 0.2, and 8 years, this should be 2016, 8 years later, his disease is still unrecordable. Saying that, I've seen him in the last few months, and he's developed bony disease, and he's progressing, and he's gone on to abiraterone. But he's had 8 years with no change in treatment and a good quality of life. Okay, it hasn't cured him, but that's very meaningful. This is a lady with bowel cancer who was sent to me a few years ago with she'd metastasized to her liver and lung, and normally we try to resect these lesions if we can. But she was, for some reason, inoperable. We couldn't remove all the disease, so we said, you can have chemotherapy. But she said, I'm feeling completely well. Why should I have chemotherapy? I said, well, your disease is going to progress. I said, well, I'll have chemo when my disease has progressed. Thank you very much. I said, fine, that's okay. So she joined a gym. She lost weight. She looked through her diet. She read my book and tried to get all the carcinogens out of her system. She took lots of polyphenols. She also took Pomi-T, but I mean, she did the whole thing. 2 years later, the metastasis is smaller and she's completely well. We will still give her chemotherapy when it progresses, and it probably will, but if that might be several years down the line. This is another man, almost exactly the same story. Now, this is important to say because I'm lucky that I have an opportunity that I can do CT scans, I can do MRI scans, I can do blood tests and monitor patients. Well, many practitioners don't have that ability. So this is just part of my routine practice. This man has been coming back every 4 months. He started off with disease in his abdomen. He had a raised blood test showing his cancer was progressing. And he did all the things I've just told about. He was very good, cut out all processed sugar. His disease is smaller and his marker of cancer is lower. So, and I was interviewed recently at one of the press said, oh yeah, but you're talking about a man with a little small node in his tummy or a woman with a small metastasis. It's easy to treat things like that. This isn't real cancer. This isn't serious, life-threatening cancer. Well, this is a woman with breast cancer who had aromatase inhibitors, which is one of the hormone drugs, because she'd relapsed with a small lesion in her lung about 4 years ago. She came back after she had an epileptic seizure. We did a CT scan, and unfortunately the disease had spread to her brain. The disease elsewhere was quite well controlled, so we said, we'll give you radiotherapy to the brain and we'll give you some chemotherapy. And she said, well, this is now pretty serious, I'd prefer not to have it, but I'm going to change my lifestyle. So she wasn't very healthy, actually. She smoked heavily, so she stopped the cigarettes. She walked out the door. I saw her 2 months later. She'd lost 3 stone. She'd got a suntan to get the vitamin D levels up. She took smoothies, Pomi-T, vitamin D. She was vitamin D deficient. She had a test and found out. And a scan a few months later, no change. The last scan, this should be 24 months. 2 years later, no change in a disease which had a 6-week survival. So, very impressive, and she did it all herself. No other medical interventions. Now, of course, I'm only showing you the good cases. I'm not showing you the cases where they did everything and they progressed and they passed away. And of course, that's to be accepted, because we do have many patients who've done everything, and I'm afraid the disease progresses. So what we're trying to say is, we're not trying to make people feel guilty that they haven't helped themselves enough. It's sometimes just bad luck. You can do everything and your cancer will progress. But what I'm trying to explain is there are many patients who have done everything and they've done well. So it's always worth trying this pathway, not only to stop the cancer growing, but also to make you feel better. Most patients, when they do this pathway, they have less fatigue, they're not depressed, and they enjoy life more. So this is the message I'm trying to get to you. And just finally, just to recap, I've told you where to get that, not with me. This is, we use a social network, so if you want to link to any of these pathways, you just go onto that website and join with one of those. And we update on a weekly basis any information from around the world which might be interesting for patients. So it's a simple case of just going to that website. So thank you very much. I hope I've not bored you too much. Just under an hour, so we've got plenty of time for questioning. And please don't just think I'm a guest and be nice. If you disagree with what I say, just tell me what you think. I won't cry too much. Thank you.